Hi there, I'm Oran Kivity, and in this video I'm going to be showing you an approach to treating tinnitus and hearing loss with Ontake. Our model in the video is in his late 30s. When he was a child, around 7 or 8 years old, he had a severe ear infection in both ears. This resulted in infected tissue at the back of his ears, and he had surgery to remove that. Following this infection, he has had hearing loss in his left-hand side for the last 30 years. In this video, you'll see that I start off by palpating the neck. This is what we call the naso area in Toihari. I also palpate the jaw, the back of his head, and the scalp, looking for abnormal tissue findings. And I treat what I find, reassess, and then continue. And you'll see that this has a very dramatic effect on his hearing loss during the course of the treatment. So let's watch.
I mean, both ears have had operations,
Right.
But the left ear, I can't hear as well, the left.
So it's not that you've got zero hearing, it's just affected on the left.
Yeah.
Right.
I can't hear whispers or anything like that.
Right. So if I come down into the neck, it feels kyo around here. Right away. I can feel this kind of softness here. And when I come up here, it feels normal, 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 and then there's this sponginess here. And I feel a little bit tender in there. Yeah. So some abnormal tissue around here. And if we come around this side, sense of softness around here. And slightly moist at the back. It feels kyo. So it's like there's not enough chi around here, so to bridge between his torso and his head. So it just feels soft in the neck. And I come around here, it feels a bit soft. And then actually around the ear, it's spongy here. So where there's tenderness, there's stagnation. So that, I think we'll do both sides. And we'll start off with supplementing the neck around here. Okay. So I'm not quite describing the gallbladder meridian, but I'm just looking for those reactions, and I can feel this strange thing here. Yeah. Means painful.
No, it feels like my whole body's softened a little bit.
Your whole body's what?
Kind of softened.
Oh my goodness. Can someone else come and compare left and right on the neck? Before and after.
Oh.
It's quite noticeable, isn't it?
Interesting.
Yeah. That's ouchy in there, isn't it? Triple bonus 16-ish. The scar is not purple, but it's slightly raised, so a little bit active. So pressing with the lip. Yeah, the puffiness is on this side, on the inside. Yeah, so let's work on that. Just rolling gently. So we've done 152, and then we can go back to 120. And I promise you that this feels really nice. Yeah, so I want the ear to get warm.
The kidney tempo.
Yeah.
It's weird, yeah, awesome.
What are you feeling, Josh?
I don't know, but I can definitely, like, this earlier was a lot quieter, whereas I can already almost hear it louder.
Well, that's significant, isn't it? All right, so let's go to the other side.
$17, $19.
19.
Yeah, and then 17.
Yeah.
Marrow.
So I just found something really ouchy in here. So I'm vibrating. And I'm vibrating quite deep. I'm pressing quite hard. I want to kind of shake it up a bit.
How's the sensation, Joe? Ouchie.
Hey, this is my treatment for ear problems. Look for reactions in the scalp, look for kyonjitsu in the neck, and balance them. Let's go to 152. The scar isn't as pronounced on this side, but there's some discoloration towards the top of it. With this, you're just learning to read the skin.
What does the different colour of the scar tell you?
The more pale it is, the less active it is. And then if it's raised, then it's active, but if it's flush, it's less active. If when you palpate the scar, you feel a kind of wormy thing, which I do here, then is that painful?
A little bit.
Yeah, it's still active. It's like it's not like normal tissue.
What do you mean by an active scar?
I mean that it's blocked, stagnation. Yeah,
See, like, so it needs work. It needs
yeah, not fully healed.
Got you.
Oh, that's hard.
Ooh.
Yeah, I just felt something really hard in there, so that's better. Okay, let's go back to 120. Can you feel the heat?
A tiny bit.
Oh, not much.
Not much.
Yeah, I'm just basically rolling out the ear.
Oh, that's nice.
Yeah.
It's got needles in it, right?
I'd like the ear to feel warm. I'd like more blood to flow into the auricle. How are you doing, Josh?
Yeah, very happy.
Yeah, what do you feel in this ear? Does it feel warmer?
Yeah.
Hmm.
It definitely sounds like louder still as well.
Sounds even louder.
But it feels like a normal hearing should be. More.
Well, that's pretty amazing. Yeah. Okay, then, so essentially, did you see what the sequence I followed? I palpated the whole neck and the scalp and looked for abnormal tissue. And what I found was this felt really deficient. So I supplemented that on one side, and then I was so amazed by the difference. I got you guys to come and double check what I was feeling. And there was a marked increase of energy flow up here. By then he was already saying, I can hear a bit better out of this ear. Then we worked around both ears, and we looked for abnormal tissue findings, and we found some pressure pain points, which we relieved. We found some cure points, which we relieved. And then in particular with this ear, I worked really into the ear itself, just trying to get blood flow into the ear. And for that, I used the small one. And now he's feeling some warmth, and he's reporting like normal hearing, which is impossible, right? Impossible. Well, I hope you found that interesting. It's really a very striking result from one treatment. During the treatment, his hearing started to equalize. He started to hear again out of his left ear. And in the following few months, he felt like he had normal hearing once again for the first time since he was 7 or 8. Now, I've just spoken to him prior to filming this segment, and his hearing has faded a little bit. It's not as good as it was, though it's not as bad as it has been. And obviously, he needs a top up. So hopefully he can get some Ontake treatment. I'd like to finish this segment by reminding you of the 3 rules of Ontake. Palpation, palpation, palpation. We palpate before treatment, during treatment, and after treatment. You treat what you find, and then you step back and you let the body do the rest. Thanks for watching.